IIT 1170 AM पे वेलकम लिसनर्स, मैं हूं आपके साथ में ईरा एंड वेलकम टू दिस ब्रांड न्यू शो कोविड लाइफलाइन विद संजीव गोयल ऑन रेडियो जिंदगी. You see, in this current situation, especially the COVID situation in India and the efforts of our local Silicon Valley technologists, IITians, ITNs, non-profit volunteers and all other residents to help out, this is a show that we bring to you to keep you updated on the different aspects of the situation. So tune into this show every day between 3 p.m. to 4 p.m. We will have it on Radio Zindagi and also on the Radio Zindagi Facebook page. We are live right here. This show, this program is supported by Troyes, NTTVC and the IIT Delhi Excellence Foundation. And now let me also welcome Sanjiv here with us. Hi Sanjiv, welcome to the show. Welcome to Radio Zindagi again.
Thank you, Ira. Thank you very much.
So Sanjiv, in this show, let's try our best to address the questions or the most commonly asked questions about the COVID situation, and right now, especially about the oxygen concentrators and the difference and the equipments and how we can do our part from here. So let's get started. First question, let's talk about, the basic difference, if somebody had to know in layman's language, difference between an oxygen cylinder and an oxygen concentrator.
So oxygen concentrator doesn't need anything. So it doesn't need to be filled. It's a device. It's typically designed for self-care or home care. So you plug the device with electricity and pretty much it produces oxygen. That's what it is. When we talk about cylinder, it comes with a pure oxygen. It needs to be filled by somebody. It comes from different production facilities. There are oxygen generators, which are very expensive and complex projects. And people are doing it. There are a lot of places things are happening, and we can talk more about oxygen cylinders in a separate segment.
Okay.
Because concentrator itself is so complex. Even I become like, I'm doing PhD in last 1 week. So it's so complex.
So about this thing, for people who are trying to procure oxygen and to send to India, what information would you like to give to the people out there, about this product, any specifications or description?
So one big one is what I want people to do is take a breath. If you don't have oxygen in your lungs, how will you send oxygen to India? I'm finding it is so much chaos. People are doing things which are not really getting there. They're getting more frustrated and it's becoming really difficult. I receive almost, my phone is flooded. I have received almost 70, 80 new messages every day. Can you send oxygen concentrator here? Can you send oxygen concentrator here? Oxygen concentrator is just a device. What people really need is not just the oxygen. They need our support. They need our prayers. So that's number one. But coming back to your question, so oxygen concentrator, number one question is it 110 volt or 220 volt? Okay. Now people are saying send 110 volt because in America we have 110 volt electricity. And we will do the conversion there and we'll do converter there. In past, we have tried shipping those devices which are 110 volt and we put the transformer or the device there. It doesn't work efficiently. Then we shipped some converters from here. Now the challenge is it's such a chaotic environment. I don't believe that can be a scalable solution where you send 110 volt units with 220 volt converter. First of all, you won't even find it. There are so many issues by the time it gets there. Will that be attached or detached? How you connect it? It's hugely complex. So if you can, please pick 220 volt, not compatible, 220 volt device. So people can plug it, they can take it to wherever they need to, and they can really get the value out of it. Otherwise, it is just going to be on hardware shipped there.
Okay, right. I mean, of course, it takes away all the headache of converting and making it compatible. So what is the best way to send it to India?
That's a very complex question right okay. Now because it's hugely complex. I'm hearing a lot of things. In fact, somebody reached out to me that there is a non-profit, you give it to them, they will ship it for free and all. My sources, we have a team of close to 250 volunteers now working on the ground nationwide. And I have a team here. In fact, even in Royce's office in India, there are people working, our employees are working around the clock with our IIT Alumni team. It's a very difficult question to answer right now. What is the best way to do it? People are doing UPS, FedEx. The challenge is all these processes are fairly complex, but it is a time of need. So if you can find a way, please go ahead and do it. I'm not going to stop you. We have created almost like a made up proposal on plea, and we send it to FedEx, and we are hoping that they will agree to it. And if they do, then we will be able to, anybody can ship it through that channel, and they will be able to do it at a more economical rate. Because right now, if you pay whatever their per pound rate, each device is close to 40 pounds. So it's not a lightweight device.
Right.
So it's a pretty heavy device.
Yeah, and then shipping from here all the way there, especially if, it is something which is very time sensitive. If somebody needs it, it has to be sent there like now. So all those things have to be also kept in mind. So talking about,
let me add about complexity around the size. Because there are a lot of confusion around kgs, liters, size. You want to talk about that?
Sure, definitely. Let's get as much information about this as possible.
So what is really happening is these concentrator comes in different sizes. 5 liters, 10 liters, some are even saying 20 liters, some are saying 8 liters. I haven't seen any other than 5 or 10 liters in the market.
Okay.
The problem is 10 liters is very, very hard to procure. It's very complex. Not complex. I'm not able to find even a single unit. One person promised me that he can get me 100 units in China. I said, I will lift all of those tomorrow and we'll donate it to the people in India. By the way, everything we are doing is all going as a donation. We are not supporting any for-profit organization. We are not working with any for-profit. But as IIT Alumni, we have partner with every single organization working on it and supporting India. So we are working with several nonprofit. I don't want to name them. There are several of those. And a lot of large donors came out and reached out to me. They are supporting us. So coming back to the question of 5 liter and 10 liters. So 5 liter is good enough for an individual, for one person. So let's talk about a person at home and you give him an oxygen tank. The oxygen tank, I'm not sure what is the size roughly, but the standard size which they are giving, it takes almost 1.5 liter, 1.5 day of supply comes in one oxygen tank.
Okay.
Now you say, oh, it's a lot, but it's not really a lot. It's only 1.5 day because you need 7-8 days. Like sometimes people are critical for at least 3 days. So it's not like you take them off and do something about it.
Yeah, and it is something that you have to have on all the time.
Right. So now talking about oxygen concentrators, these are continuously generating it. So now the 5 liter capacity is good enough if the person is not in a super critical state. If somebody is in a super critical stage where he needs to be in ICU, 5 liter is not sufficient. But in that case, you are not going to be on insulator, oxygen concentrator only. You need medical help. You need serious doctor attention. You need nurses around you to make sure that everything is working the way it is supposed to. So at that stage, I'm not sure how much value a large oxygen concentrator can provide. However, some hospitals have reached out to us and they said they can use these concentrator for even ICU. Now that is an interesting use case. If you can use a 10 liter or 20 liter, which is not available, at least I couldn't source any 10 liter one, and you can convert a normal hospital room into an ICU, that is a game changer. So we are working on it, but as of now, supply is so short that it's almost impossible to get that. On top of that, I don't believe a lot of 10 liter oxygenators are even sold because these are not for home use. Home use 5 liter is plenty.
So we spoke about weight, and you also gave us some pretty good insight into the product. So for people who would like to buy this, what would you say? How much do they cost? And is it better to buy this here and then send it to India, or buy it in India directly after it's been sourced over there?
So, Ira, this question is again a very complex question. Where and how? Time, it's war against time.
True.
So it's how quickly can you get it? If you can get it in India, absolutely go ahead and buy it. There is no question about it because you save days.
Yeah.
Anything you ship from here, by the time it is cleared and by the time it is delivered, it will take at least 4 days.
Okay.
That's the minimum amount of time by the time we are shipping and it is arriving to the destination. And if it is a smaller city, it can be even 5 days. So if you can buy something locally, absolutely.
Right.
Just be careful. Whatever you buy the product which will last. I am hearing news about the quality. Most of the manufacturers are doing a pretty good job, but still just make sure that you are buying products which are of decent quality, at least has decent rating.
Right, which are like authentic and of course dependable. So, and if somebody buys those products in India, let's say, like you said, if it's readily available and if it's, you really need it urgently, if someone does buy it in India, what about it's the servicing or service centers or maybe spare parts? Would they also be available in India?
So some manufacturers do have their service centers. So one we are working with, they have a service center in India and they are going to provide after sales support. I believe the one we are procuring, it is 3-year warranty.
Okay.
So we are hoping that it is going to last longer than any other device out there. But I have been told that there are several manufacturers have service capabilities in India. Again, if you are buying a product, please verify it. IIT Alumni team, we have set up a Slack channel and we are consolidating a lot of resources around who is doing a good job, who has capabilities to everything. You're welcome to check that out or join the Slack group. It is a public group. We are not controlling anything, but our team is continuously watching it and adding information as much as possible around these resources.
Right.
But on the same note, Ira, this is not a complex device. It's just, we don't have time. People are saying and chasing me, oh, Sanjiv, why IIT can't do it? Why he can't do it? Why she can't do it? It's not about desire not to do it, or it's about the technology. We are very, very smart people, very intelligent people. We have in India extremely, I can't even tell you how phenomenal people are there. I mean, Indians are industrial people. We can make air out of thin air kind of thing. So using that as a so I'm one of the IIT came up with a design. We have even shared the design with few industrialists, local industrialists, not a big one. And I have been promised before the end of this month, we will have fairly large volumes of oxygen concentrators made in India. I'm just waiting for that. I'm keeping my fingers crossed. And they are promising us it will be 8-liter capacity, which is almost as good as ICU level oxygen. And that is what I'm very, very excited about. And I'm really hopeful they will be able to deliver. Prototype is working. Can they deliver in the production? I don't know, because it's a medical grade device. So the problem is there are so many unknowns, and there are some parts of it we are sourcing from United States. And there is another nonprofit working with us on that. It's not purely, so we are not making it all about IIT. This is about humanity. We are partnering with every single person we can help. This is a different nonprofit. They are working with us. We gave them the design and they are taking it further.
Well, it's not about IIT, but we definitely owe it all to IIT. If this thing definitely works and comes out in the market, and like you said, you are very hopeful. So fingers crossed. Yes, our best wishes to you. Especially, you see, what is also commendable in this whole thing is when you say that it is completely non-profit. There is no for-profit organization that is involved in here. So it's absolutely amazing. All of us pray that this really works out and it's available as soon as possible. So Sanjiv, anything else that you'd like to?
I just wanted to add a few things here.
Sure.
Not only it is non-profit, every single person who is volunteering has contributed, not just their time in dollars. Every single person. So we are fully committed to make this thing better, and we owe it to India. It's our privilege as an IITian to help and work with India. India is the reason all of us, 500,000 of us, achieve these meteoric success.
True.
So we are grateful what nation has done for us. It's not like we are doing anything for them. It's our responsibility, and it's an honor that we can help. So I want everybody to know that we are not doing it. We are not doing any charity. This is not a non-profit thing for us. For us, it's a privilege. For us, we owe it to every single Indian citizens, because you even paid for our education. Every single IITian is IITian because 1.3 billion of Indians paid for our education and still paying. So I'm really grateful. I'm seriously, honestly, the reason I'm doing all this is I feel indebted to all of them. And that's the emotion every single one of them.
That's the thing, Sanjeev. That's exactly what I mean. That you said that, we owe it to India. All of us owe it to our country. But how many of us really feel like that or think like that, How many of us realize that? So that itself is very, it is a big deal, and probably the first step to realizing that, okay, we should do something.
We feel so helpless. That's the only problem right now we have. Is we can't do enough. We can't do enough.
So
I know it's 3-4 more weeks, but we will be there. We will finish it. We'll finish it.
I can probably, low key or borderline probably understand how anxious you must be, how, you must be looking forward to the results of those prototypes. So Sanjeev, how can people get in touch with you and your group? Like you said, it's a public group. How can people reach you?
So we have the COVID group, IIT COVID group. I can send more information about it. It's a Slack channel. I am available on Instagram, Sanjiv Goyal Futurist. We have a website, iitdef.com, iitdef.com. It's a non-profit site of our IIT Alumni. This is another common question people are asking me: if they want to donate, how to donate, who to donate. It's a very tough question right now. I will say, you should donate to IIT Delhi Excellence Foundation, but we are not the only one. There are so many non-profits doing a wonderful job. Please donate to the organization you support. Please donate to the organization you feel comfortable with. It's not about me or them. Only request I have, which I even put it on my Instagram page: do not donate. Yes, please do not donate to organization that spends hundreds of thousands of dollars in advertising. You know where the hell the money is going. The money is going to somebody else. But there are so many good organizations, wonderful organizations. Think of more than oxygen concentrators. People need food. People need so many things. People need support. It's just do whatever you can. $10, $25 does not matter. Just go and do whatever you can.
Absolutely. Well, Sanjeev, thank you so much for also, again, reigniting this inspiration, for inspiring all of us again. And yes, very important, you even if you don't know where to donate, you should know where not to donate. And
Yes.
it would be really helpful, since IIT Excellence Foundation is such a credible source, and your Instagram as well. Just a request, do you think you would be able to probably compile a list of these organizations who you think are authentic when doing the ground level work, so that people can at least follow a list and pick someone from there to donate their money to?
So we are doing our best, and we are putting all the information in Slack channel of ours, which I'll share with you, and then you can share with Facebook Live, the complete link. We are working on that, but again, we are not flawless. I just want to know we are doing everything we can. We may share some informations which we may not be able to vet it. However, our team is very, very carefully picking information. Our team is setting up a 100-bed hospital in Bangalore right now. Wow. They have already raised some funds. Everybody's working hard. They need your prayers. All volunteers needs your prayer. Even the hospital workers, people who are working in healthcare, they need your prayers. I believe India needs prayers more than just the money. I even talked to some very senior government official. I'll prefer not to disclose their name. These are the people who advise at very senior leadership level. All they are saying is it's no different than what it was in New York 1 year ago. Now, it's a challenge. what we saw 1 year ago in New York is no different. But people are reacting, world is reacting very differently. And that is what hurts me most, when people are talking about India and they're bashing India and they're saying negative things. That is the problem, Mira. We need to stop. Instead of 4 people, we are against a lot of people. We are doing things which is damaging our own roots. It's the greatest nation. We believe in that. You believe in that. We all got this far because of the foundation. India needs prayers more than anybody's dollars. They will fix it. They will figure it out. We should just support them. This is not the time to bash anyone. This is not the time to go against anyone. Let's do our part. That's my request. And coming back to oxygen concentrators, I won't be surprised within 4 weeks' time, we'll have so many that we will be worried about what to do with that.
Amen to that, amen to that.
Amen to that.
Thank you.
We are setting up 16 plus oxygen generation units. So if anybody, this is an appeal I have from your audience. If you know zeolite suppliers or people who can help us get zeolite, there are 16 generation plants ready to go, but they need zeolite. They are converting these nitrogen plants to oxygen, which is not a very complex thing to do, but the raw material is zeolite. That's one thing I'm looking for at this point of time, because one oxygen cylinder can convert anything into a ICU. That's the biggest thing.
Absolutely.
Thank you. Thank you very much.
Thank you, Sanjiv. Thank you for this technical information as well as the philosophical and this inspiration. Thank you for being here. Listeners, this show is going to happen sometime between 3 and 4 p.m. every day of this week. So stay tuned. We'll have more information about these concentrators on the following shows. Sanjiv, thank you once again for being here. I'll talk to you tomorrow.
Thank you.
Thank you. And thank you, listeners, for tuning in. You stay tuned to Radio Zindagi.